was called the world's first pregnant man, and today he gave birth.
But the court has gone the whole way, said there is an absolute constitutional right to same-sex marriage.
Hurricane Harvey is pelting the Texas coastline.
There is an increasing attack on freedom of religion, speech, and conscience.
Welcome to the Issachar Hour, examining law, policy, and culture through the lens of the Judeo-Christian worldview to help you understand the times and know what you ought to do.
Well, good day, good morning, good evening, whatever part of the world you are. Welcome to the Issachar Hour. My name is Wayne West, and this is my wife, Doreen. And last time we started looking at this transgender craze, and we looked at it considering that there is a significant difference between science and worldview, and the transgender craze is being driven by worldview, not by science. Science is the study of the natural world. It gives you facts, it gives you data. Your worldview is your commitment, the way you see it, the way you understand it, the way you interpret the world, and the way you act when given either data or in fact really you have an a priori commitment to operate in a particular way. Last time we talked about, we showed you a video from the Queer Kid stuff on transgenderism, and showed that the Anglican Church was essentially identical to the people who are looking to create a world that is nihilistic, meaning that everything is permissible, and anarchist means that you're answerable to no one.
You should say the Church of England.
The Church of England, my apologies. The Church of, because it's not the Anglican Church, the Church of England, and so on. So what are we doing today?
Well, I think today we are going to overlap a bit by showing the last video that we showed the last time, or the last part of the video we showed the last time, in which Abigail Schreier, who is, as we say, a well-educated woman, has a law degree, a philosophy degree, and she's written a book.
Yes, Irreversible Damage, Teenage Girls and the Transgender Craze.
Right, so we are going to look in more detail at this book this week, and we are going to start off by looking at the last thing we showed last week, which is her talking about different types of gender dysphoria or different types of gender confusion and how it's changing, what is new about it today, what is the new thing today. Because gender dysphoria, or the ill-ease with your sex that you're born with, has been around for some time, but there are some dramatic changes occurring now. And so she starts off the section this week, we're going to show again by talking about three different manifestations of this and how they differ.
So we start with the video now. So you can.
So she's looking at how did we get here, what is gender dysphoria, and how the three different types, populations in which it manifests in different ways.
So let's talk about the transgender phenomenon. I'm going to start by walking through the major issues and claims about youth and adolescent gender transition, and we'll work our way to the big question, which is, how did we get here? How did we get to a place in which we're all supposed to pretend that the only way you know that I'm a woman is if I give you my pronouns? How did we get to an America in which a 15-year-old in Oregon can begin a course of testosterone without her parents' permission? A lot of the answer, of course, comes from the hard left, but at least one part of the answer is conservative squeamishness about issues we'd rather not deal with at all. So let's begin by dealing with it. What is gender dysphoria? Gender dysphoria, the severe discomfort in one's biological sex, is absolutely real. It's also exceedingly rare, typically afflicting roughly 0.01% of the population, and overwhelmingly males, so roughly 1 in 10,000 males, meaning nobody you went to high school with. And it typically began in early childhood, ages 2 to 4. Little boys insisting, no, mommy, I'm not a boy, I'm a girl. Boys who were insistent, consistent, and persistent in this feeling that they were in the wrong body. It is, by all accounts, excruciating. I've talked to many transgender adults, most of them biological males, and they describe the relentless chafe of a body that feels all wrong. Now, there are at least 3 separate issues I'm going to talk about today. There are the young kids who have this classic presentation of gender dysphoria, some of whom, the majority of whom, would have naturally outgrown it on their own, and historically did. Others became what we used to call transsexual adults. There's number 2, there is the social contagion currently spreading among adolescent girls, many of whom do not have typical gender dysphoria at all. And third, there are the activists who have already begun exploiting our confusion and our sympathies in order to invade women's protective spaces and destroy women's sports. They are all very different. Okay, so the young kids. Now, traditionally, as I said, these were overwhelmingly little boys. And if left alone, meaning with no intervention either to change their name and pronouns, what we now call social transition, and no medical intervention, over 70% of these kids typically outgrew gender dysphoria on their own. Most would end up as gay men, and some would not. Some would not outgrow it and go on to be called, what we used to call transsexuals. These were not, transsexuals were not people who used to pretend they were somehow really women or were always truly female. They were just people who felt most comfortable presenting as female. I've talked to a lot of transgender adults, and they'll tell you they know that people can tell their biology is different, but their goal isn't so much to fool other people as it is to achieve a level of comfort with themselves. For many, that involves hormonal intervention and surgeries, and I have talked to several who say that hormones they took or the surgeries they underwent brought them a measure of peace. I can also tell you that they are generally holding down steady jobs and are leading good, productive lives. But today, we don't just leave kids alone who say this and let chips fall where they may, letting some kids outgrow their gender dysphoria and others to transition when they reach adulthood. Today, we decide the moment a child seems not perfectly feminine or not perfectly masculine, today we say, I know what this is. This is a trans kid. We take them to a therapist or doctor, nearly all of whom practice so-called affirmative care. That is, nearly all of whom have accepted that it is their job to immediately affirm or agree with the patient's self-diagnosis and to immediately help them medically transition. Teachers affirm young children in school, both by teaching the class that only they, the children, know their true genders, and encouraging kids to reintroduce themselves to the class with their new name and pronouns. Therapists affirm and encourage minors down this path, and even pediatricians do. And the typical next step for these kids after changing their name and pronouns to their friends and classmates is puberty blockers. Puberty blockers shut down the part of the pituitary that directs the release of hormones catalyzing puberty. The most common of these drugs is called Lupron, a drug that was originally used in the chemical castration of sex offenders. To this day, it has never been FDA approved to halt healthy puberty. Now you might ask, why would any parent or doctor do this? Why would anyone stop the puberty in a child, even a child with genuine gender dysphoria, when that child would be highly likely to outgrow the gender dysphoria if left alone? Some say because it's traumatizing to let a child go through the puberty of the sex to which they don't wish to belong. The problem of this, of course, is that in many cases, puberty does seem to have helped children overcome their gender dysphoria.
Right, so Mrs. Schreier is talking about 3 different populations and how they are very, very different. First population she talked about was traditional gender dysphoria, which is a real condition that has existed for some time, primarily among young boys, 2 to 4 years old.
I was a little bit surprised at that, actually.
Who thought they were girls. Yeah. But then you called yourself a girl when you were a little boy yourself. You called yourself Wendy.
Correction. I was the only boy among a number of cousins.
Girls,
in fact, I was the only boy among all of the girls. So my grandmother actually called me
Wendy.
No, my grandmother called me Mr. Wayne. because she recognized
Go
I was
to
the
the
only
Wendy part
male.
to be relevant
But
to what we're talking
my sisters and
Call
my
you Wendy.
cousins used to dress me up as a girl and call me Wendy.
Well, there you go. Right.
So
there you go.
they used to, but they dressed me. It's interesting. They used to dress me. I was probably about 2 or 3 at the time.
2 to 4 years old.
Yeah, and
yes.
they would dress. I never asked to be dressed as
I
a girl.
know, okay.
They wanted me to conform to them. I
Right.
never did.
Okay.
And so on and so
But
forth.
I'm just making the point, though, that it's not all that foreign because
Yeah.
between the ages of 2 and 4, your female relatives dressed you as a girl
Yeah.
and called you Wendy.
They wanted me to be a girl. I
Right.
was never.
Okay. But the point is made.
In fact, when I could come home from school, my mother used to refer to me as Dirty Jim, but that's a different.
All right. So anyway, so we're saying that the traditional gender dysphoria that she talks about, 0.01 of
Yeah.
population, first of all, in terms of its prevalence. Secondly, primarily boys,
Yeah.
young boys between 2 and 4, like Wendy.
Yeah.
And and what she goes on to say is that most of these boys, if left alone,
Yeah.
not given any drugs or any surgeries,
Yeah.
70% or more of them would grow
Yeah,
out
I
of
actually
it.
thought the figure was about 90%, 80 to
Yeah.
90. That's
I think
what
that
I
may
think.
differ when it comes to the teenagers that we're going to talk
I
about.
don't know.
But she's talking about the young
No,
boys.
I'm talking about these
Right.
boys that they would grow
Okay.
out of it. Just
So she's saying
automatically.
more than 70% of them would grow out
Yeah.
of it. She also said some of them would, in their adult lives, become homosexual.
Yeah.
And some of them would become what you call transsexual.
And you know,
they would be cross-dressers.
we always
and so
knew
on.
of cross-dressers. I mean,
Yeah, they always
as a
existed.
growing up and just a reality, we have always known there were people called transsexuals who were cross-dressers.
Yes.
But they never ever said that they were
They
women.
never claimed the opposite gender.
Yeah.
They simply felt more comfortable pretending to be the opposite gender,
Yeah.
dressing in the clothing and the mannerisms of the
Yeah.
opposite gender, and they did it. So what you're saying is that most of these young boys who had this real gender dysphoria would get out of it.
Yeah,
left
absolutely,
alone.
Absolutely.
Some of them would become homosexual men,
Yeah.
and some would become transsexuals, who
Yeah.
were men but
Yeah.
dressed in female clothing
So
and
that's
carried
it.
on a female persona. Okay?
So we have a different ideology, a different worldview has now come on the
but,
scene.
but now she's talking about 2 other populations.
Yeah.
She's saying the second population is a group, a recent phenomenon
Yeah.
of teenage girls.
Yeah.
Teenage girls who have suddenly decided that they are trans.
Yeah, and she develops that in the next video, so we
Right.
don't want to preempt
So
that.
yeah, but she's saying that's the second population, which she's
population.
going to talk about later. These
Yeah.
female teenagers who 13 and 14 or 12, and they decide they're trans. Okay,
Yeah.
that is unprecedented.
Yeah.
That never happened before.
Before.
It's a new phenomenon
She's
of
made
our
the point
time.
that in the 100 years of diagnosing
That was
gender
never there
dysphoria,
before.
that was never a feature.
It is a new phenomenon.
And we really want to make that point, this is a new phenomenon. Yeah.
It hasn't existed for 100 years.
Yeah.
And then she's talking about a third group now.
Yeah.
And she's saying these group are activists.
Right.
They are activists who claim female identity
Yeah.
in order to go into female spaces
Yeah.
and dominate the female space.
Yeah.
So they are activists, they claim female personality, they are political about it,
Yeah.
and they
Aggressive.
demand the right to go to be in women's jails, women's prisons, women's beauty contests, women's sports events, and so on. And some of them have raped women in these institutions, especially in the jails.
Yeah.
And so there have been boxers who have entered the boxing arenas, women, and so she's a third group. So this is what she's talking about. And she's saying now that these young females of the second group, who never before had traditional gender dysphoria, what is happening to them now is that they are being affirmed.
Right, but not only them, because even the first group, she's saying that there has been a radical change in the approach of number of
Doctors,
institutions. So even with respect to
Right,
the
right.
first group,
Yeah.
we now have doctors affirming
Affirming them, and parents too.
and
affirming
teachers.
them, and teachers affirming
So
them.
when in the past you had a boy, a little boy, he might have been a little bit confused, and people maybe left them alone and so on.
Yes.
Now immediately those
Even at 4 years old.
show any kind of thing.
Yeah.
People jump in and say
Oh,
you are
he's trans,
and
yes.
then they
start him on a regime
a
of
regime.
social transitioning, as she calls it,
Yeah.
which is getting a new name. So
That's
they
right.
give the child a new name.
Right.
So like Wendy for Wayne.
That's
Okay,
right.
they give the child a new name, allow the child to dress in different clothing and social transition. And then later on medical
That's right.
transition.
So what has happened is that something that used to be standard medical treatment, observation with expectation for
What
recovery.
we call spontaneous resolution.
Right. The whole society now
Has catapulted to it.
yes,
and it's affirming
and
it.
it's affirming it. And
making it irreversible.
And media, doctors, everybody is
buying into it.
The question is why?
Why? Okay.
Why is this happening? We're not so sure. But let's talk a little bit about what the American Psychiatric Association
says about gender dysphoria. Right.
It says the term transgender refers to a person whose sex assigned at birth, that is the sex assigned by a physician at birth, usually based on external genitalia, does not match their gender identity. So there's a discordant between, in physical medicine, you can have, instead of having normal stomach cells in your stomach, sometimes you have what they call pancreatic tissue. You have a pancreatic rest. But we don't call that normal, do we? We call that abnormal. That's ectopic pancreatic tissue. In fact, there are women who, instead of having the lining of the womb, which is it's endometrium, that's the lining of the womb that gets ready for a pregnancy, and if the woman doesn't become pregnant, it sloughs off as the monthly cycle. If that endometrium is within the wall of the womb, we don't call that normal because it causes a lot of problems. We call it adenomyosis.
But sometimes that endometrium is in the nose.
That's right. And sometimes
they bleed from their nose at the time of their
period. In the lung.
Could be in the lung, could be in any part of the body.
That's right.
And we don't call it normally, call it endometriosis.
That's right.
It's a very painful condition and can cause infertility and pain and so on, because the endometrium, which by design is in the innermost part of the womb.
That's right.
To facilitate pregnancy and so on. That endometrium ends up outside the womb.
Yeah.
In the abdomen, in the nose, anywhere in the body else except that.
And we don't call it
we don't call that normal. We don't say that is another identity for endometrium. We say that is endometriosis. It's a disease.
It's a disease.
It causes pain. It causes abnormality.
But the medical community, for whatever reason, basically because of a worldview commitment to achieve a particular purpose, has decided to
make gender dysphoria an identity.
An identity. Instead of being an abnormality,
it's an identity.
So in other words, when you cast off design, when you cast off God, then everything, and that's basically it. So what they want to say is that there is no design in the universe, there is no purpose as regard to sex or identity. So anything anybody identifies as is fine. That is their worldview commitment. And it is their worldview commitment only for gender identity and sexual orientation. Is not their worldview commitment for endometriosis. So you see the incoherence and the corruption.
Or for race, you can't just get up and say you're a white man tomorrow.
No,
they wouldn't accept that as identity.
Yeah.
They would say you're crazy.
So the American Psychiatric Association says some people who are transgender will experience gender dysphoria. And the reason why they say only some people will experience it, because not everybody is stressed about it. And in psychiatry, you must have stress about it. So
for it to be an abnormality.
So if you are stressed and concerned about anxiety, they say gender dysphoria, which refers to psychological distress that results from an incongruence between one's sex assigned at birth and one's gender identity. All right, so that is how gender dysphoria comes about. If you have it and you don't care about it, it's all good. If you have stress about it, then it's called gender dysphoria. They say although gender dysphoria often begins in childhood, some people may not experience it until after puberty and much later. So this is gender dysphoria according to the American Psychiatric Association. The thing is, interestingly, the American Psychiatric Association still refers to gender dysphoria as a mental disorder.
Yes.
But the World Health Organization has removed it. Because the World Health Organization ideologically is a nihilistic and anarchist organization, meaning they want everything to be permissible and that people can be what they want. So they have taken it upon themselves to not consider gender dysphoria to be any abnormality at all.
It's just an identity.
It's an identity.
A variation of
a variation of normal, yeah.
Right. So the APA, American Psychiatric Association, says that gender identity is different from gender expression.
Right.
You see, they have all these differences.
Different things, yeah.
So your gender identity is different from your gender expression.
That's right.
So your gender identity is what you think of yourself in your head. Your gender expression is how you manifest that identity, how you dress and so on, whether you do use a binder for your breast to flatten the breast and
Yeah.
so on. That's the expression of your gender. But the identity is what you have in your head about who you are.
You see the wisdom of the scripture when God said that God said there are two types of human beings, male and female. All right, in terms of how they are to be identified. And he also said that they should dress in a way that is different so you can tell the two apart. And that, in the Old Testament, God laid that out. And I suppose he saw, not suppose, because God would see all the way down, he saw this crazy transgender, and it is crazy.
Well, in point of fact, back in the Old Testament days, the Canaanites and so on, they used to do cross-dressing as a part of their weird, kinky worship.
That's right.
And their prostitution, male prostitutes and so on. They used to do cross-dressing. And so in order to be distinct, the God's people were told, do not do any cross-dressing, effectively. But the APA is saying, though, that gender identity is different from gender expression, one. And they're saying your gender expression does not have to align with your identity, right? And they said diverse gender expressions, just like diverse identities, are not any indication of a mental disorder. This is what the APA says.
Yeah, because that's their worldview.
Yeah.
And it's important.
In other words, they say wearing a dress is a feminine gender expression, right? That's what it is, culturally. But they're saying that wearing a tuxedo is a masculine gender expression. But they're saying your gender expression doesn't have to match with your identity.
Because that's their worldview. I just want to bring that up.
And it's not a disorder.
No, in their worldview.
So if you're a man who wears a dress, that's not a disorder.
So the American Psychiatric Association does not have the worldview of the Bible.
Well, yeah, well, it wouldn't. Yeah.
Well, there's no reason why it couldn't, because the worldview of the Bible is it's the concept, the word that in the beginning God created the heavens and the earth is still the only logical explanation for what we observe in the universe. We see that the universe is very well designed. We see that there is no evidence that matter could just organize and become alive. We see that there is no evidence that a living organism can develop new organs or new body plans. We see all of those things. So it is still the most logical thing that God created the heavens and the earth. But the American Psychiatric Association, its worldview is not consistent with that. Should Christians accept the American Psychiatric Society worldview?
But the APA says you have gender identity, which is how you think of yourself in your head. You have gender expression, which is the cultural expression of gender, male or female, right? And then you have sexual orientation, which is what you're attracted to sexually, who you're attracted to sexually. And so sexual orientation is different from gender identity, different from gender expression, in the words of the APA, and it relates to who are you attracted to. So they say people who are transgender, that is somebody who is born a man but identifies as a woman, they can have any sexual orientation. They can be attracted to men or women or both or neither.
You remember we came across a guy who identified as lesbian but was attracted to women? A man who identified as lesbian.
There's a man identified as a woman, but said he was a lesbian because he was still attracted to women. I think that's how it went. But anyway, so...
And he kicked off a
real
woman
lesbian.
Who was a lesbian.
Because she questioned...
Yes, this is just chaos and confusion. This is straight out of the book of the devil.
So anyway, so the DSM goes on to talk about dysphoria in adolescence, which is what Mrs. Schreier is talking about primarily in her book.
In her book, and which we'll be coming to, Yes.
So the DSM goes on to talk about the gender dysphoria in adolescence. And it's an incongruence between your experience or expressed gender and your assigned gender. It has to last for at least 6 months.
And again, we want to say that this is a matter of worldview, not science. It is a fact that people can feel that way. How do we interpret that fact? In the biblical worldview, which is which accepts design and purpose and function by God, that the universe is designed and purpose, and human beings are to function in a particular way. In that worldview, we'll say that this is a disorder. If the universe has no design, no purpose, and human beings can say what human beings should do, then you, like WHO, the World Health Organization, could say this is just a variant of normal. So what we're looking at here is a worldview issue. It's a clash of worldview, not a clash of science.
Right, so in the next video, which is coming up, we are going to look in more detail at this teenage craze of gender dysphoria, right? What is called a rapid onset gender dysphoria, which is a phenomenon seen in teenage girls. So Mrs. Schreier is going to be talking more about this in the next video.
Yes.
How the term came about, who coined the term,
Yeah.
and why they coined that term, and what are the features of this.
Right.
Gender
Okay.
dysphoria.
Okay.
100-year history of diagnosing gender dysphoria. These little kids were what we were talking about when we talked about gender dysphoria. But in the last decade, thanks in large part to social media, there's been another population that claims to have gender dysphoria. This is a population that never before had gender dysphoria in any significant numbers. In fact, before 2007, there was no extant scientific literature on their having gender dysphoria at all. Teenage girls. This is the phenomenon Brown University public health researcher Dr. Lisa Littman called rapid onset gender dysphoria. And it refers to a sudden spike in transgender identification among teen girls with no childhood history of gender dysphoria at all. Not only have the rates of these girls claiming trans identification risen dramatically in the US and all across the West, over 4,400% rise in teen girls presenting for gender treatment at the UK's National Gender Clinic, for instance. But teenage girls are now the leading demographic of those claiming to have gender dysphoria. What's going on? The answer is social contagion. One more instance of teen girls sharing and spreading their pain. There's a long history of peer contagion with this demographic, of course. We know that anorexia and bulimia spread this way. And we know that this demographic, teen girls, is in the midst of the worst mental health crisis on record, with the highest rates of anxiety, self-harm, and clinical depression we've ever seen. We know that the population who tends to fall into social contagions is the same high anxiety, depressive group of girls who struggle socially in adolescence and tend to hate their bodies. Add to that a school environment where you can achieve immediate valorization and popularity by declaring a trans identity, and of course, the delicious temptation to stick it to mom. Add further the great many trans social media influencers who can't wait to convince troubled teen girls that identifying as trans and starting a course of testosterone will cure all of their problems. And you have a very fast-spreading social phenomenon. I've spoken to families at top girls' schools that will attest that 15 or 20%, or in one case 30%, of the girls in their daughter's 7th grade class now identify as trans. When you see that, you're witnessing a social contagion in action. There is no other reasonable explanation. These teen girls are in a great deal of very real pain. Almost all of them have dealt at some point with an eating disorder or engaged in cutting or been diagnosed with other serious mental health comorbidities. And now they're being allowed to self-diagnose with gender dysphoria by a medical establishment that's decided its job is merely to affirm and agree with these girls. A medical establishment that has, with regard to trans-identified adolescents, effectively turned its doctors into life coaches. Since my book, Irreversible Damage, was published in June of 2020, more evidence than I ever could have imagined has come out indicating that this thesis is correct. You may not know the name Kira Bell. This is a young woman in the UK, very troubled in adolescence, who was rushed to transition in her teen years and came to regret it. She underwent double mastectomy and spent years on testosterone, only to realize that her problem had never been gender. She sued the National Gender Clinic in England, and back in December, the High Court of Justice examined her case and the claim of similarly situated plaintiffs, and she won. The court examined the medical protocols applied to her, protocols identical to the ones we have in America, and the High Court of Justice was horrified. It was absolutely appalled that a young girl had been allowed to consent to eliminating her future fertility and sexual function at an age when she could not have possibly gauged that loss. She had begun transitioning at 15. This case was called a landmark case in England. It was covered by the Times of London, The Economist, and even The Guardian. It was seen as a real condemnation of the effort to fast track so many young girls to transition. And one of the things the court noted was that the clinic had been unable to show any psychological improvement in the girls it had treated with transitioning hormones. If you didn't read about the landmark Curabell case in the American legacy media, well, that's because they decided to pretend it didn't happen. Just as they continued to ignore or dismiss the stories of the thousands of detransitioners. These are young women who underwent medical transition and later regretted it and attempt to reverse course. A lot of these treatments are permanent, but they do what they can to try to reverse some of the effects. So in America, the teen trans phenomenon gets treated as a conservative issue. That is a political issue rather than a medical one. And so perhaps the greatest medical scandal of this decade is dismissed as a conservative preoccupation.
Right, so now Mrs. Schreier had talked about rapid onset gender dysphoria, which is the craze, the phenomenon. She calls it a social contagion, or a psychic epidemic in teenage girls. But she's making some point about this. First of all, how did the term rapid onset gender dysphoria come about? It came about because Lisa Letman is a doctor. She's a liberal, okay? She's not a conservative like us. She's a liberal. And she was concerned with an epidemic of transgenderism in a small town in Rhode Island. So Dr. Letman saw this, and in one town in Rhode Island, there was like an epidemic of transgenderism, okay?
Just to remind our listeners that for the first 100 years of psychiatry, gender dysphoria was mainly diagnosed in young males, never really seen in females, but suddenly there was a 400% increase in this thing, and a lot of girls were getting, teenage girls were calling themselves gender dysphoria, and she came up with this consideration. And she was from Brown University, I think it was, is that correct? Yeah.
So Lisa Letman, she's a liberal lady, she's not a conservative, but she was concerned because this epidemic of transgenderism burst out in one small town in Rhode Island. Now, when she did the research, she realized that between 2016 and 2017, the number of gender surgeries had gone up times 4.
4 times?
4 times.
That's 4 times the money.
Right. And then she realized also that, I think you alluded to this, in 2018 in the UK, over the previous decade, there was a 4,400% increase in teens seeking gender treatments. Over 4,000 percent increase in teens who are seeking gender treatments. And then in this cluster that she found in Rhode Island, there were female preponderance in teenagers, adolescents, young teenagers, and usually, I mean, this is such a contrast to what usually occurs. So she found this interesting. Lisa Letman did, right?
Yeah.
And so Lisa Letman did a study. What every good researcher should do. If you see a phenomenon, you study it, right? Yeah. So Lisa Letman did a study. She looked at 256 parents of teenage girls. She did a study. She talked to the parents, parental interviews, right? And she looked at parental reports about 256 parental reports, okay? Yeah. This was in 2018, it was published. And she found that 65% of these girls who burst out in this gender transition, transgender thing, it came in after an intense social media immersion. After they started spending a lot of time on social media.
Right. And the reason for that is?
On social media, you have the enablers, the suggesters, and the persons who suggest that they do this and enable them to deceive their parents in order to get it done. Okay? And they make it very appealing. It's a belonging thing and so on. And,
So there are groups of people on social media who are influencing teenage girls. who already, a lot of them apparently have mental problems.
Yes, they feel odd. They don't feel like they like their bodies that much.
Yeah.
They have depression.
Yeah. Well,
they feel isolated.
Apparently, it's a fact that most young girls don't like the way they look. They feel it. They don't look as good as other people. And this girl is prettier than them. And all that insecurity.
And not only that, there is some social isolation to some of them. They lose friends. And so it's a challenging period of time. And adolescence is a challenging period of time. And so these social media persons now are coming out on social media with all their different groups, and they are encouraging these girls to, you're trans, so act like it, and this is how you can hide it from your parents. Okay? So Lisa Letman found that the social media immersion was a precursor to this craze, right? And she called it a peer contagion.
Peer contagion.
Contagion is something that's catching.
And there is a definition from the American Psychology Association, which we'll read in a short while as to what a social contagion is. But she was saying that this wasn't really a mental disorder that was inert or inherent, but rather it was a behavior
caught on in a peer group.
In the context of a peer. And let me ask you a question. And that was well received by the academy. In other words, the intellectuals. Yes or no?
So actually, it was not received well at all.
Was it received at all?
Mrs. Schreier this defined a craze, because she saw it as a craze. A craze is an idea that spreads quickly through a community of persons. It's a craze. And it has an abnormal amount of energy in one direction. One direction.
So this thing, she called it rapid onset gender dysphoria.
So it's a craze, it's a social contagion. And
well, let me just be fair. Let me just be straight up. That concept was rejected by the American Psychology Association, by the American Psychiatric Association, and the World Professional Association for Transgender Health.
Yes, they rejected it. And not only that, the activists, who we talked about as a third group of people in the whole gender thing, the activists call her dangerous, call her biased, and said that talking to parents about their daughter's transgenderism is like asking the Ku Klux Klan if blacks were inferior.
Right.
In other words, they said, obviously the parents are going to give you that kind of biased information. And so they wanted to put her as just a biased person.
As Abigail Schreier, as Abigail Schreier said, doctors, media, these associations are all affirming. Their worldview is to affirm transgenderism. So when this young lady, this person, Miss Littman, came up with the idea of rapid onset gender dysphoria,
she had a publication
being a social contagion, in other words, being due to pressure, peer pressure, etc.
Social media.
These people all rejected it.
They jumped on her.
No,
in fact, Brown University had a press release about her journal, right? Her publication. They removed the press release. They canceled their own press release. They issued an apology about her publication. They apologized for it. The editor of the journal apologized for publishing the article, although it was peer reviewed.
It was peer reviewed.
It was peer reviewed.
But they subsequently started to criticize it for methodology and all sorts of things.
They apologized for it, and they said they want to issue it with a correction. They're going to reissue it with a correction. So they pulled it and said, we're going to reissue it with a correction. The lady was said to be a bigot and a bully. She had a job with the Department of Health, and because of this, they said she was harming transgender youth, and so she was fired from her job as a consultant.
No,
all of this happened because she published this true research about this gender.
And we must remember that some researchers in the United Kingdom actually wrote an article, I can't remember who they wrote to, but they wrote expressing concern that they were unable to do research on transgender issues because of the hostility and so on that they would receive. They don't get grants for it as well. So in other words, what is happening here is that the associations that should be looking out for the health of the individuals have an a priori ideological worldview commitment to affirm transgenderism, and anyone who, like Miss Littman, who gives any research that does not support that affirmation, you are going to be crucified in
Cancelled.
in the academy.
And cancelled.
And cancelled. You are likely to lose your job. That is where we are at.
So the thing that Issachar was talking about was the complicit behavior of medical professionals, schools and universities in fostering this craze, this contagion among teenage girls. See? The medical profession fosters it by affirming them. As soon as a girl comes and says, I think I'm trans, oh yes, you're trans. Sure. You need to stop puberty now. So go on this drug called Lupon, which is a drug not approved by the FDA for this. Go on this drug. If you're going to a school, you can change your clothes in school if you want to a boy's clothes. Change your name in school to a boy's name. They'll put that name on the register. They'll call you by that name, and then you go home and pretend that it didn't happen. So they foster this deception of parents in the schools.
Well, you know, the thing about it is that she mentioned a case in the United Kingdom of a young lady girl who started transitioning at Kira Bell or something like that. Kira Bell, yes. She started transitioning at 15, and as a result of the processes that she underwent, she inevitably became infertile. Right. So she sued the NHS because the doctors in the NHS, like the doctors in the United States,
just affirmed.
They just affirmed, as she said, whereas in 2007 there was only one child, any clinic for children who needed to transition. There were 400, I think, when she did this lecture, sometime between 2020 and 2021. And although there is evidence, as the researcher Littman found, that this is in fact a contagion, because young girls, teenage girls never had this problem before.
It's a suggested thing.
But these various groups who are supposed to be looking out for the welfare of the young girls have all rejected the concept, although they still can't say why it's happening. So they can't say why it's happening, but they
just say it's normal. And the approach to it is affirming it.
It's affirming.
You must affirm it. If the girl is going through a phase, she gets depressed, maybe she broke up with her friends criticize her or don't say they don't like the way she looks, she's lonely, she might have a bit of autism, whatever, she looks different. She's going through a phase of depression for that. She goes on social media, they tell her, you're probably trans, you're trans. She listens to a lecture in her school, which they bring in trans people now in the schools to give lectures, to give their life stories.
And all the drag queens and so on.
The drag queens come in, the transgenders come in, and so the girl listens to a transgender story and says, that's what I am, I'm trans. She goes to the doctor says, yes, you're trans. And they start them immediately on drugs to block puberty. And then they put them on testosterone.
So she won her case at least in the first judgment.
Kira Bell,
in the first judgment.
2020, she won her case against the National Health Trust.
This was in the High Court in the US, in the UK. Now the High Court is not the highest court in the UK. The highest court, I think, is the Supreme Court.
No, the Privy Council.
No, the Privy Council is for the colonies like ourselves.
Okay.
In the UK, you have the Supreme Court, which is the highest court.
Right.
So it was overturned at a court that is higher than the High Court, but I don't think it has gone to the Supreme Court. But it hasn't gone to the Supreme Court.
Okay, so in 2020, the High Court said the doctors a child at that age cannot consent to getting these kinds of medications, which have permanent side effects. Infertility, not a joke.
Infertility.
So the court said the child cannot consent to that at that age, and so it was wrong. They couldn't do it. But 2021, late in 2021, September 2021, a higher court, the appeal court, overturned it because the clinic appealed. Okay,
right,
and they overturned it, and the girl was very sad. Kira Bell was very sad about the overturning, but Pink News, Pink News.
Pink News, LGBT news. What did they say?
Pink News. Listen to how Pink News reported it. Talk about Worldview. Pink News says court overturns cruel ruling.
Cruel ruling.
Depriving trans kids of life-saving puberty blockers.
One of the things.
That's how Pink News reported.
Well, of course. Life-saving puberty blockers. Well, they will do that because, and one of the things that they seek to do, the LGBTQ people, is to change up language, and then they use words in a way that
So drugs that make a young girl infertile are called life-saving.
Now the High Court who made the ruling said there was the NHS could present no evidence that their treatment resulted in any improvement in the mental health of these people. Yes. So here you are cutting off girls' breasts, etc., doing all sorts of experimental surgeries on them, and you have no data to support your claim that these things which were causing infertility were in fact having any benefit in terms of the mental health of the individual. But nonetheless, the doctors, the media,
and the appeal courts,
and you know,
buy into the social media.
She made the point that the American mainstream media, we're talking about the CNNs of the world, the MSNBC of the world, who are all left-wing, and all our local mainstream media in the Caribbean, whether they are, you know, TVJ, etc., they are all tend to be left-wing. None of them reported on this case. Nor do they report on the thousands of people who transition and are detransitioning.
Because they regret it.
Because they regret it. But these media houses do not report on these things because they don't want you to know it. In fact, the media houses and their cohorts in the medical association and so on, instead of making this thing what it really is, a medical issue,
they make it a political issue.
They make it a political issue and say that conservatives are making too much fuss over this thing. Let me just give our audience the definition of a social contagion from the American Psychological Association. A social contagion is the spread of behaviors, attitudes, and affect. Affect is your mood. Through crowds and other type of social aggregates from one member to another. Early analyses of social contagion suggested that it resulted from the heightened suggestibility of members and likened the process to the spread of contagious disease. Subsequent studies suggest that social contagion is sustained by relatively mundane interpersonal processes such as imitation, conformity, universality, and mimicry. Also called group contagion, and then they say you should see other things such as behavioral contagion, emotional contagion, and mass contagion. The people who are advocating this and who are advancing this worldview are corrupting science, they're corrupting language, etc., in order to spread this thing. They have created a whole set of new terms, like, I used to be a man.
No, you're a cis man.
No, I'm a cis man. You are a cis woman.
I'm no such thing. I'm a woman.
Well, this is what they would.
I'm not any cis anything.
So
I reject that.
They have coined.
And even the little teddy bear was saying it in the show we did before. Little teddy bear.
So
So children are not going to be learning this language.
They are indoctrinating children. Okay.
Yeah.
So the Bible is out of
schools.
The Bible which maintains order, purpose, etc. And what is being brought into the children is chaos, nihilism, and anarchy as it results. So you have cisgender. Describes a person whose gender identity aligns in a traditional sense with the sex assigned at birth. That is normal. Okay?
That
Cisgender,
is not cis.
that is not cis. That is
just who you are.
Normal person.
You have XY chromosomes, and you have male genitalia, and you're a man.
Yeah.
And there's nothing cis about it.
There's nothing cis about it. People who have any incongruence there
have a problem.
Are mentally
and you need to be addressed. The problem needs to be addressed.
And you need to address it.
Now, one of the more important points that Rebecca is her name? Abigail Schreier makes in her book, Irreversible Damage, is the role of the therapist in affirming and concretizing this otherwise temporary ideation in the teenage girls. They affirm it quickly and they jump on it and they make sure it's there, it lasts, okay? So they affirm the self-diagnosis. Where on earth, as a doctor, can a patient come to my clinic and say, Doc, I have leukemia, and I just say, oh yes, leukemia is it, and start on treatment? That's not done. Patients do not self-diagnose, doctors diagnose them. But in this case, the doctors allow 12 and 13-year-olds to self-diagnose. The child comes to them and say, I'm trans.
And even younger than that.
I'm trans. And they say, okay, you're trans. Let's see how we can help you. That's a jargon, that's a language, right? And they say, the affirmative therapy, which is just saying, yes, you're trans, let's help you. You know, they endorse a falsehood.
You know,
they endorse a lie. Because it's not true that these girls have any genuine gender dysphoria.
No, they don't. They don't really have. They have a social contagion. But you know, these people are seeking to make their worldview the basis for human rights and the basis for law and public policy. This is why she mentioned the Equality Act, which the Democrats were trying to pass, they're trying to pass in the United States,
and which the transgenders want to latch on to as well.
That's right.
But listen, what the therapists are saying to these young, confused, sad, depressed, stressed out girls
who have mental disorders, who were part of the anorexia and bulimia, which was at one time part of the social contagion.
Yes, which are also social contagion. Right? But they're taking a back seat now because trans is it.
Trans is it, yeah.
Right. So they're saying a girl with gender dysphoria is a boy. That's what they're saying. That's what they're saying. A girl with gender dysphoria is a boy.
Yeah,
it's ridiculous. And these people are doctors, right? No, American Medical Association affirms this.
Pediatric Association.
American College of Physicians affirms this. Yeah. American Academy of the Pediatricians affirms this. Yeah. And the Pediatric Endocrine Society affirms this. And as you said, the World Professional Association for Transgender Health also.
And this, as we say, is not science. This is worldview. What they are affirming is their worldview, that everything is permissible, and that nihilism, meaning that everything is permissible, and anarchy, you can do whatever you want according to it. That is what these groups are affirming. They are not affirming the science. The science merely says that these people are abnormal. The question as to what do you do with that information is a matter of
what they do is affirm it.
What they do is affirm it.
And say it's just an identity.
Just an identity.
Which is ridiculous. So in her book, Mrs. Schreier gives a very good illustration, an analogous illustration to this, right? She says a boy and his mother come into the clinic, right? To the therapist in the clinic. And the mother said, my son, something is wrong with my son. He says he's a chicken. He says he's a chicken. Yeah. So I brought him to see you to see if you can help, because he insists that he's a chicken. Yeah. And the boy says, one thing about us chickens, we know what we are. Yeah. Right? So the therapist says, well, he says he's a chicken. You know? And the mother says, well, clearly he has lost his mind. Clearly he's abnormal. Clearly something is wrong. Yeah. The therapist said, no, you are the one talking to a chicken. So the therapist said, no, you are the one who's mad, because you are the one who's talking to a chicken. Yeah. Right? So the therapist absorbs the boy's abnormality and makes the mother the sick person.
Yeah, absolutely.
Right?
Absolutely.
And that is what they're doing.
We have to differentiate between science, because what these people do, they seek to claim that the science support their worldview, but the science merely tells you that these people are not lining up with what they ought to be. And our worldview is that they are abnormal, just as in physical, they have physical disease. When you have abnormal cells,
they have mental disease, and they have abnormal thoughts.
You have abnormal thought. But the commitment of all these associations and groups like the World Health Organization is to affirm
a disorder as an identity,
based on
to impose it on the rest of the world.
Now the question that we need to ask ourselves is, should we allow people who reject order and purpose and design to tell us what is normal and what we should do? And medicine is in fact based on the concept of order and purpose.
It used to be.
But now it has been shifted.
Totally.
Should we go along with that?
Because medicine is talking about birthing people.
That's right.
Because they say there are men who can give birth, so they are birthing people. There are men who are menstruating, so they're menstruating people. Right. So the medicine, the OBGYNs in some of these institutions, they can't talk about women,
No.
They'll get punished.
Because, Elizabeth Warren, as we come to the end of today's program, we take it up again next week, Elizabeth Warren said that if you do not affirm the gender identity of these children, you are going against their human rights. And it brings us to, where do human rights come from? And we would argue that the only place that you can position human rights, or you can provide a philosophical basis of human rights is that all human beings have an inherent value. And the only place that all human beings can have an inherent value is if all human beings are made in the image of God. So the whole concept of human rights based on desire and nihilism
is incoherent. But listen, the whole idea is incoherent.
Yeah.
For example, think about this. Suppose a black girl goes to a therapist, right? And says, I'm white. I like white things. I like white music.
Yeah.
I like white food.
Yeah.
I like what white people do. I like to do. So I'm white.
Yeah. They also accept that.
I don't want this nose. It's a black nose.
Yeah.
I don't want these. Do you think therapists say, oh, you're so right. You're white.
They
Let's give you some bleaching cream. No, they cannot do that because it's race.
Yes.
So you see the incoherence of taking this stance for gender.
So as we leave it today, we'll take it up again next week. We are dealing with total incoherence.
And we look at the underlying reason,
right.
the real reason why they are doing it. I think we should do that next
And we'll
week.
be doing that next time. Until that time,
this has been the Issachar Hour. Thank you so much for joining us. So join us again next week with a friend as we look at the last section of transgender ideology.
Distinguishing science
from worldview. Is the whole world gone crazy? Perhaps. Let's look at that next time.